Hi guys, Dr. Aly from HTS Clinic. Now this week we're going to do something very different. I'm going to get some FAQ, frequently asked questions, from you guys for me to answer. Can hair transplant be done by using beard or your chest? Back hurts, my shoulder hurts, my neck hurts, my arm hurts. Of course, there'll be some people who tell you 97, 98, 99%, there is still going to be a chance of it falling if today, with technology and all, the rejection rate is still very high. Here, different. We're going to kickstart right now. So hit me. Question 1.
Is hair transplant a painful procedure?
Is hair transplant a painful procedure? Yes, it's very painful. For me, my back hurts, my shoulder hurts, my neck hurts, my arm hurts. For you, on the other hand, you have anesthesia. Anesthesia from the back, so when I remove, you don't feel anything. And the anesthesia in the front, so again, when I put the hairs back in for you, you don't feel anything much. Maybe towards the end, you might feel just a little bit of stinging, but once we give you some analgesia or some painkillers, you'll go back feeling just right, and you most likely will be able to sleep without even any medication.
What is the success rate of hair transplant?
What is the success rate of hair transplant? Now, hair transplant, 10-15 years ago, the success rate was only 50-50. Today, with technology and all, the success rate is way much higher. What it means is, 10 people who do hair transplant is not 9% get hair and 1 don't get hair. 10 people who do transplant, all 10 get it. But the amount of hairs that I put in, if I put in 1,000 hairs, 900 or more would grow back for you. So that's what I mean by 90% success rate.
Who performed the hair transplant procedure?
Who performs the hair transplant? Now in HTS, we are vastly different compared to many other centers. Many places, they get a combination between a doctor and then a nurse, or sometimes even a technician who's not even a medical profession trained person. They just put them through a certificate and let them do the transplant for you. Here, different. What we do is, the doctor is the one who's going to be removing the hairs from the back for you. The nurses will just clean and arrange. Then the doctor will be the one who re-implants them for you. So at HTS, you are guaranteed only a doctor touches your scalp from beginning all the way until the end. And that makes you very safe, and you are ensured high quality with a doctor's guarantee.
Does hair transplant looks natural?
Does hair transplant look natural? Most of the time, it comes back to the design. So while we will help you to design, there has been cases whereby patient wants an unnatural design. I try not to do it, but if you really want to and have a weird design, well, not too weird, but may not suit the face, then we probably will have to sign off with you. Otherwise, if you trust what we're going to be doing for you, it's always as natural as possible. What is important is I need to adjust your age. So if you're young, you can have a straighter hairline. If you're older, the hairline has to curve a little bit more. If you are rounded face, the design is different. If your face is narrow, again, it's very different. Males and females also have different designs. So I don't use tools whereby you just put in and standard hair design. Everything is tailor-made to your face, your features, whether you are heart-shaped, straight, round, square, all tailor-made for you to look as natural as possible.
Will there be a scar after hair transplant?
Will there be a scar after transplant? Very good question. So, the International Society of Hair Restoration, or ISHRS, states that a hair transplant is always a procedure that has scar. There's no such thing as zero scar or no scar. That is entirely a lie. Now, the scar usually would happen at the back. All methods of hair transplant would have a very long scar with a stitch. With the FUE procedure, you have tiny dots. Generally, we finish and your hairs grow back, you won't see anything. However, if you shave your hair, you shave it down to a skin fade, you shave it down to a number 1, number 2, you might see tiny white dots. Not significant, but it's still a scar, and you deserve to know the truth, and that is the truth. FUE has scar, but very minor scars.
Can it be guaranteed that the implanted hair will grow and not fall of our life?
Can you be guaranteed that implanted hairs will grow and not fall for life? This is tricky. Now, once upon a time, many people would say a hair transplant is for life. I have changed my stance. So a hair transplant is long term, alright? There is still going to be a chance of it falling if you do not take your medication, if you still practice poor lifestyle, if you do not look after your hairs, or if you have other medical conditions that can cause the hairs to fall. So while a hair transplant is going to give you a couple more years of really good confidence and really good aesthetics, you still need to look after it together with your doctor so that we ensure it stays on as long as it can.
Can hair transplant be done by beard or chest area?
Can hair transplant be done by using hairs from the beard or your chest? Good question. Yes, it can. Now, generally, we still want to use the hairs from the back of your head. These are the best hairs because they have a lot and they are the closest match to your head. But on the other hand, if you run out of donor hairs, what we can do is we can take some of your beard. However, we cannot take from the face and we can't take from the front. If not, you have all these patchy white dots on your face and you don't look really good. So we have to take it from underneath your chin, which means some of you may have quite a lot of donor, some may not get much. Chest hair is also possible, however not very practical. Reason being, each of these hairs are only one hair per follicle and they curl really badly and they do not grow long. You've never seen anyone with a ponytail on their chest anyway. So high likelihood, even if we take this, it's mainly for minor coverage. It's not going to be great results.
Can hair transplant be done with graft extracted from my sibling or anyone else?
Can a hair transplant be done by using hairs from a sibling or someone from your family or maybe your close friend? Well, the real answer is no. Not at the moment. Even if you are identical twins or if you are a DNA match, you can't. The rejection rate is still very high. But some of you would say, but how about organ transplant? The heart, the kidney, the liver, why is that possible? Now the real reason is larger organs, we can actually stitch the blood vessels together. Alright, let's say, or a new kidney and in your old body, there's always a blood vessel, we can stitch it together and we force it to uptake. Your hairs, however, we cannot force the blood circulation. When we put in, it's either it accepts or it rejects. The take-up rate can only be 15 to about 20%, so which means you're going to have about 80 to 85% rejection. That's really a waste of good hair from your donor or from your friend or from your sibling, and it's a waste of your time because you've implanted, went through the whole process and nothing grows. So the answer is no, I don't recommend it at all.
Can women also do hair transplant?
Can female do hair transplant? That's a very good question. The answer is yes. So females can do hair transplant. However, we want to do a check first. We want to check your hormonal status. We want to check if there's any other issues that's causing a female to have hair loss. This is especially true if the female has hair loss from the front to the back and it's what we call a diffuse pattern or it happens all throughout your head. Those kind of cases of hair loss in women, high likelihood can be due to hormonal issue, can be also some kind of other underlying diseases which we need to check. Once we have checked and if there's enough hair to transplant, it can be done. A different category of ladies whereby you just have your hairline, your very high forehead, alright? That's what we call just hairline. You were born with it, you don't have hair around the hairline. Yes, we can do the transplant for you with very, very high success rate because there's no underlying issues, it's just born with high hairline. So, depending which status you are, want to know more, come by, let us know, do a consult with us, let our doctors check for you, we will reassess for you, then we will plan for you so that you get the best plan of a hair transplant journey. You want to get more FAQs done, just drop us a couple of questions down below, or you can even comment, share, like our content, or even subscribe if it's on YouTube. Right, so until the next time, that's me, Dr. Aly on HTS Clinic.